So welcome, colleagues. Welcome to those who are here in person, which is wonderful, and also to anyone who's coming in, as I can see, in the virtual space. My name is Marcia Meskimen. I'm the director of the Institute of Advanced Studies. As a little bit of housekeeping, let me just point out, if you are joining us online, that you are able to use both the Q&A and the chat function. If you want to add some comments or have a question, by all means do that. We will monitor that and ensure that our speaker today is able to respond to those questions in due course. Otherwise, welcome to the virtual IAS, and we are very, very delighted to be welcoming our IAS fellow, Godfrey Ndlovu from the University of Cape Town, who's an economist who very much works at the cutting edge of questions around social inclusion and resilience, and who is hosted while he's here at Loughborough by my colleague Hassan Ahmed, who is a colleague from Loughborough's Business School. And again, they have been working, as you can see probably already on the screen, they have been working together for a few years now on some very, very interesting work on the notion of social inclusion and poverty. And specifically, we're going to hear today about the experience in Cape Town. And so I'm very, very excited about that. I'd like to turn over for a moment to Ahmed, if you'd like to say a few words about your work and about Godfrey.
Yeah, well, okay, yeah, I'm Ahmed Hassan Ahmed from the Loughborough Business School. I've been generally recently working on financial inclusion and its ramifications, so such as welfare and other stuff. And I have the pleasure of working with Godfrey, who is a very good colleague and based at the University of Cape Town. Godfrey does similar work like me, and of course that's the main attraction, although we met initially in PhD supervision, where a student was sponsored by British British Council? British Council, British Council, and part of the requirement is to get an academic from the UK to be on the panel, and that's how I got in touch or got in contact with Godfrey. And since then we have been thinking along the line of the research areas that both of us share interest, and this is a work that we started thinking about based on household survey in South Africa. And South Africa is an interesting case because of it's not distant past history and race inequality in particular, and the role of gender and so on. All these are coming up. So, and these are some of the things we want to look into from the household survey provided by the independent survey researchers in South Africa. Mm-hmm. And this is a preliminary work, so we are still working on it, and comments are highly sought, and we will definitely consider every bit of advice that comes from. So that's, sorry, I hope I have not spoken too much yet.
No, not at all. So thank you very much. And I think we're saying over to you.
Oh, thank you. Thank you so much for the kind introduction. We have been working together with Ahmed, as you're saying. Yeah. Okay. We are going then to using this unique survey data from South Africa on households. So the FinScope surveys, they specifically collect data on households in a number of African countries. They've been doing that, I think, for the past 10 years or so for now. So the advantage now with these surveys is that they are also country representatives. They also use the country census as the weighting. So now the weighting schemes, now when we are presenting the data, they sort of represent the perspective or the general average in a specific country. So for that reason, then we thought that maybe instead of gathering fresh data, it might be wise then to tap onto this. Specifically, these two sets of surveys. So they did a survey in 2019. Sometimes they do this yearly, sometimes they do it in 1 year and then in another. Then they also did another survey in 2021. So we then want to take now advantage of those two surveys now, considering now that there was the issue of the COVID in 2020. So I want to look at now to say how are the changes in poverty levels or household economic status before the COVID and after the COVID. But specifically, our interest now is on the impact of financial inclusion and financial resilience. So our main objective then, just using that COVID as a natural experience, we want to check now to say, how do households respond following a financial shock, where we're saying now that COVID had a financial shock across all particular households. So I want to check now to say, is it the case that now if a household is financially included, it responds better or different from the one that is not financially included? Then we also ask the question now to say, does it vary also between households that have high financial resilience and those that have low financial resilience? And of course, we also want to interrogate the issue of gender differences, where we're saying now, to what extent then does this widen the gender gap, or to what extent does it reduce the gender gap amongst those particular households? So a lot of research has been done along the issue of financial inclusion, when initially those who are interested in the research, you find that initially the initial work was mainly focusing on measuring financial inclusion and also looking at how does it affect poverty and other outcomes. So where a number of people then argue and say, no, it appears that if people have access to financial services, then it actually helps them to come out of poverty, and it also reduces inequality. So the terms financial inclusion and access to finance are often used interchangeable. And often now when we talk about financial inclusion or access to finance, we're talking about access to formal financial services, where we're just looking at whether there is a household member maybe with access to a formal bank account or a credit account or any other forms of account. A lot of research has been done from the US perspective, where some then find that now when you compare immigrants and non-immigrants, if immigrants have access to finance, then it also helps them to actually maneuver and find their way out. Some people say, no, it actually reduces not only current poverty, but also the exposure to future poverty. It also improves participation in labor market. And those maybe who are in formal activities, then financial access to finance also improves their business conduct. It also improves the investment in education, where people are able then to educate others. And recently, one study that I found interesting is the evidence that now when you improve access to finance, it sort of also improve post-harvest losses, which I then found interesting now when you look at the divergence of the views now when you look at those. But now, even despite that now, most people have criticized financial inclusion. So the main argument now is, when you look at financial inclusion, we're just focusing on the provision of products and services. But then it doesn't really tell us now to say, how does one rebound when they're faced with a tragedy or when there is a financial shock? So this is where now financial resilience comes in. So when you're talking about financial resilience, then you're saying we are looking at the ability of a household or an individual to rebound back to their normal or to a better situation after they experience a particular financial shock. So the main argument now is, if we just focus on access to finance or financial inclusion, we're not able then to capture that element now to say, how does one rebound in the face of an adverse financial shock? So really the work on financial resilience is sort of very relatively new. The term was actually introduced around 2016 when the guys it was actually borrowed from social exclusion. So it comes now to say, then looking at that now, individuals maybe might need to be resilient in order to maneuver their way within any particular system. Then the term now financial resilience was actually brought in. So before that now, most people were just focusing on financial literacy, financial capability, but then now people then are coming to realize now that the importance of financial resilience or financial fragility. So as I have said now, how does one respond when they are faced with a particular shock? So the key argument now is for anyone to respond, they should be able to have access to both internal and external sources. So where your internal sources maybe include maybe your previous savings and maybe your ability to restructure your expenses or your budget, and the external sources maybe will be your friends or relatives or other people who come in that particular perspective. So we think then now, because of the COVID, a number of people have been coming in now to say, how did the COVID affect the maybe household behavior or household outcomes? So we think that maybe because that the COVID on its own, we consider it to be a significant shock on a household. So now our key question now that we want to answer is, how do households that are financially included or households that have higher resilience, how do they rebound after this particular shock? Is it the case that maybe those that are financially included emerge with higher household or welfare outcomes or less? What about those now that have high resilience? Is there any difference between those? So we then use those two samples, and then now we consider now the households that are financially included and those that are financially excluded. And in conjunction with that, then we also look at the issue now on gender differentials to say, are there any gender differentials? So we acknowledge that a number of people, as I have said, have looked at financial inclusion, and they're saying financial inclusion has a significant impact on poverty. But then we want to ask the question now to say, which one maybe might be better? Should we focus on driving financial inclusion, considering that over the past decade, a number of ideas or initiatives have come in focusing on financial inclusion, but the changes in poverty, they are very marginal, if ever they are there. Perhaps maybe it is not mere inclusion that is required. Maybe we need then to come up with policies maybe that foster a financial resilience. So as you have already highlighted, our work is still preliminary, but we find some interesting results even when we're looking at that. As I said, we're using two sets of the FinScope surveys. So the main advantage now is one, the census weighted, so which is a true representative of the country. So what we do then, we construct specifically 3 indices. We construct a financial inclusion index and also a financial resilience index. So we construct the index over each period. Then we want to trace now, say, how do then households behavior change over that particular time. Our poverty index, we can call it a well-being index or an asset-based index. It is a generally common approach whenever people are measuring household socioeconomic status to use an asset-based approach, where you look at now the number of assets that are held by the household. One would argue and say, why are we not using income? So income has always been a challenge in the sense that now there is evidence that it is always reported with error. So whereas now when you look at household assets, then they then indicate now long-term household wealth. And also sometimes some of the income will be seasonal, so there is no guarantee that it will actually continue in future. So that's why then most people now, when they are measuring household poverty, then they decide then to use the asset-based indices. Also, people in health use the same approach, and even the World Bank, they also use the same approach. So we use this unique or this nice estimation technique, which is called the triple difference estimation approach. So where we're looking at now, so we categorize the households into 2. So those that have access to finance, we call them the treated, and those that do not have assets, we call them the control. So now I want to check now to say, is there any difference between these households that have been treated with this assets or with this resilience compared to those who are not treated? Obviously, then the challenge now that we face now is these surveys are collected at 2 different periods, and they rarely follow the same households. And even if they follow the same households, it will be very difficult for one to pick the same household from one survey to another. So what we do then now to cater for that, then we use a propensity score matching, where we match the households based on household specific characteristics. We match households in both post and before the COVID-19. So we're then looking at households that have similar characteristics. So in other ways, you're looking at now to say, if this household had financial assets in a particular year, how does it compare with the households that has similar characteristic in the following year? So we use that then to match household. We have tried different ways of matching, but then the interesting thing now is the results are very similar. So in the results that we present now, we use what we call nearest neighbor matching, but we also tried inverse weighted. We also tried a kernel-based weighting. The results are pretty much the same. So we also presented those just for robustness check. So our main estimation technique is as presented in the equation that I have put there, where the treat now depends on whether a household has access to finance or a household is considered as financially resilient. So we're also considering the issue of the gender. The variable post there indicates whether the sample or the survey was done post or pre-COVID. So it will be 1 if the survey was done in 2021, and gender will be 1 if the household head is male, and 0 if they are female. So our main coefficient of interest there will be beta 7, as I have highlighted it in a different color there, where we're looking at now to say, what is the effect now of being treated when you are then look at now to say the gender outcomes then before and after the COVID. So then this will tell us now whether there is a difference between treated male households from similar households which are led by females. So that's the main element there. Of course, then we control for both household characteristics and state level characteristics. So under state level characteristics, then we're comparing maybe to control for the place in which the household live, whether in a rural or they're in an urban area, and also the province where they live. We also put those controls. Also put a number of other household controls like the age of the head, the race, the level of education, and a number of other elements as well. So the key assumption really under this methodology is the issue of the parallel trend. So the idea under the parallel trend assumption now is if there was no intervention or all factors constant, the change in both the treated and non-treated households should be the same. If, say, for example, the COVID results in a reduction in household wealth, so before or if access to finance does not affect that, then the change in the wealth levels of the households should be the same. If they are both increasing, they should increase with the same magnitude. If they are both declining, then they should be both declining with the same magnitude. So we call that the parallel trend assumption. Of course, it is often not easy to test. One way will be to test that graphically. We tried a number of graphs, which shows that from the graphs, it would appear that now the trend is not similar across gender. So where it is wider for for male-led household, and it is straight for those which are female-led. But that, of course, is not a thorough test because you're just looking at the graph. So another way of looking at it then will be then to split the sample by gender, and then you also split the full sample across gender. then you compare the coefficients. So where you want to check now whether there is a flat trend across those. So that's the test that we did. So we split our sample by gender, and then we split the full sample across gender. And then we test now for parallel trends on the triple difference estimation. So based on the test, we conclude that we can we cannot reject the null hypothesis, and we conclude that there is evidence that there is no parallel trend within this. But now when we eliminate that, then we can then use that then to assess the results now to say, looked at or based on the condition that a household has access to finance or does not have access to finance, then we can evaluate the outcomes. The second assumption is the issue of the exogeneity, when the real assumption here is no household would have anticipated that they have COVID, and therefore they adjust their wealth in response to COVID. So our assumption is that now, if ever there is any household that did that, that was just purely random. So no one could really anticipate and then adjust their long-term wealth. Also, that's another advantage now of using an asset-based index, because it measures long-term wealth as opposed to income, because income might actually receive a shock as well. So we also assume that now, so it actually means that now, if there are any household who anticipated this and they adjusted their wealth, then this assumption would actually form. As I have said, we also assume now that the timing of the COVID is exogenous and it affected all households equally, if we factor out the issue of access to financial services and also the issue of resilience. So one of the first elements that we measure is the issue of financial inclusion. So as I have said, it's not that complicated to measure financial inclusion. There are a number of well-agreed ways of measuring financial inclusion. So we follow the approach by the World Bank, where we consider a household to be financially included if there is a member in the household who has an access to a formal bank account. So there are various, I think there are over 19 bank accounts, then we look at them. So what's interesting also is our results, they also align to the levels as reported by the FinScope in their report. So which means that now we can rely on our results. So we consider a household to be financially included. Some use the word banked, some use the word the household has access to finance if there is a member in the household with a bank account, and then we quote them 0 otherwise. So the second issue that we try to measure is the issue of financial resilience. As I have said, financial resilience is a relatively new concept, which was pioneered by the guys, as I have said now, 2016, 2019. So a number of people then have been looking at financial resilience. So what most studies that we have, based on the papers that we have read, most people, when they are measuring financial resilience, they just ask one question, that is the ability to raise funds in the case of emergency. But then, as you're saying now, the guys who came up with the concept of financial resilience suggested that now financial resilience has 4 dimensions. So the first dimension now is the access to social capital. So if you are able then to say you have a network of friends that can assist you and you are able to raise funds in emergency, and maybe you have your own savings club, in South Africa we call those the stock fellas. So if one has access to that form of social capital, then it actually increases their financial resilience. So remember, when we're talking about financial resilience, we're saying how easy is it for you to rebound after you have faced a financial shock? So if you have that social network, then you should be able to rebound. So the other dimension is the issue of financial knowledge and financial behavior, where you look at now to say, what happens? So the good thing now is the FinScopes ask a number of questions around these particular elements. So one question that I ask now is whether the person has a personal budget. So the idea now is if you have a personal budget, then you are able then to structure your finances and you know where to alter if you have a financial shock. And then the other question that they ask now is whether somebody immediately withdraws their money if it is deposited. So if you always withdraw your money automatically, then it means that now if in the event of a financial shock, you might not be able to rebound because you don't have any other money. Then the other question that is asked now is whether the person has missed any of their credit or debit payments within the past 12 months. So now if one has been missing, then it means that now they are at risk now. If there is a financial shock, it affects then their ability to rebound because already they are actually struggling. So it also asks now to say, do you consider that the current level of credit that you have, is it a burden? They also ask now whether one has they look at 4 or more credit accounts. So we consider that now to say if one has 4 or more credit accounts, then this person has a financial burden. It affects their ability then to rebound as well. And maybe also the ability of their money to cover their living expenses. So if your current amount is not able to cover your living expenses, then you are also at risk in terms of financial resilience. So the third dimension now is the economic resources, where they ask a question again to say, do you have money that is set aside for a rainy day? So the argument now is if there is that kind of money that is set aside, then it improves financial resilience, because in the event of a shock, then you can tap into those, or whether they are currently saving or they are borrowed. Then the fourth dimension now of financial resilience is access to other financial products, things like your insurance, funeral cover, and maybe a pension fund or a retirement fund. So the argument now is if a household has access to those, then it also affects their or improves their ability to rebound. So we look at now financial resilience along those 4 dimensions. So one argument that we are trying to say we are adding is the fact that now we are trying to look at all the key dimensions of financial resilience. Of course, maybe it also offers an opportunity for us to expand the analysis and maybe to evaluate now which of these dimensions then is more effective in assisting households to move out of poverty. Is it social capital? Is it financial behavior, or economic resources, or access to some of these other elements? So we also do a similar thing now where we look at our wealth index. So the way that we calculate the wealth index, we calculate it so that it becomes consistent, because we're using an asset-based wealth index. We calculate it separately for rural-based and for urban-based households. So that's the common trend that is used. Even the guys at the World Bank and those that are in the Department of Health, and they also use that particular approach. The argument is if you just consider or you combine the two, some assets which are considered to be an indicator of high wealth in rural areas might not be considered as high wealth assets in urban areas. But then we calculate it that way, and then also we calculate another using the combined sample. We find the two are highly correlated. The correlation is 0.998%, which means that now, whichever way we use, it does not really affect the outcomes. So in the slides that I have here, we have just presented the unconditional mean by gender for each of the years. So what you can see here now on the top top rows or whatever. So we have separated these according to male and the female. So the top one represents the total. So where we're saying now from the surveys that we have in overall, so we can say now if we are using both samples, about 81% of the population is financially included, if we consider both just that on average. So these figures are also in line with those that are reported by FinScope. As I have said, we are using survey-weighted results. But what is actually coming in now is, it is very interesting that now when it comes to financial inclusion, female-led households have higher financial inclusion than male-led households. This doesn't come as a surprise, as I have said that now when we're looking at financial inclusion, we're looking at access to a formal bank account. So now, because most women maybe especially if they are not married, they end up opening these financial accounts so that they get the social grants. Maybe that is the reason why we end up having that high indicator there. But then now when it comes to financial resilience, and the issue is slightly different. So we find that now male-led households appear to have higher financial resilience than female-led households. And this is consistent across both samples. And also, obviously, then the other issue now is the issue of the wealth index score, where we're saying now male-led households appear to have higher wealth than female-led households, which is also a very interesting finding. We also then check now to say, are there any variations by race? So what, as per expectation, we find that now families that have Black African families, they are the poorest across the entire sample and across the years. So we find that those are the poorest, followed by sometimes colored and maybe, yeah, and that is also consistent across. And as expected, also white-led families, they are all also, in terms of wealth, they are well off, far way above the average. Because if you look at now, say, for example, the total average of the score that we calculated using principal component analysis, it will be negative 0.98. Yet the score now for whites is 2.8. I think it's more than 2 times the average value. So it shows now the wide variations in poverty across gender, across race, and across a number of dimensions, which we also found very interesting. Although in the analysis, we don't take the issue of gender further. So we also find the same also when it comes to financial resilience, where Black families have lower resilience. But an interesting element now comes in when it comes to the issue of the COVID. So you realize that now all races after the COVID, it appears that financial resilience went down. But this is the opposite for Black-led families. So which is something maybe that is maybe worth interrogating. It could be maybe the issue of social capital and the other issues. So that's why I was saying then we need to also then reinterrogate the other issues now to say, what is it that maybe led to that particular element? But we found it very interesting that now they have a higher score compared to others. So which means that maybe they learned something, or during that maybe they improved their networks and they are able perhaps maybe even to tap from these and leading to that kind of reduction. So one key element now when it comes to this difference in difference approach, where we are matching samples from different periods, as I said, is trying to match the households in both the treated and the untreated group. So where you are looking at now, remember, as I said, we have a sample from 2019 and another from 2021. And these are taken from different samples. So for us then to compare these now, we need to match the households based on similar characteristics. So where you are looking at now to say, what is the level of wealth in 2019 for a household that has similar characteristics to the other? So we are comparing a household in 2019 to another household in 2021 that has similar characteristics. So for us to do that, then we need what we call a common support. So as I said, we use a propensity score matching using nearest neighbor matching. As I indicated also, when we use other matching methods, we get similar results. So the graph there that I'm showing now then is showing then the area of common support. It is not clear, but when you look at it close, you realize there is a blue element there, which shows that now amongst so the red are the treated households and the green are the non-treated. So this is the wealth distribution of the households after the COVID, and this is the wealth distribution before the COVID. So that blue line there is just showing the number of households in the treatment group which could not be matched with any corresponding or household with similar characteristics in 2019. So which then reduces our sample. I think when I was checking, there are about 100 households which were not matched. So then that automatically reduces the sample. But one thing about this then, because without a common support, then we cannot compare, because we are not comparing a similar household. So then we're able then now to say, when we're making this comparison, this is based on households with similar characteristics. All other factors constant, if it wasn't because of the differences in the treatment, then they should have landed in the same place. So for that reason, then we can infer a causal implication on the results after we have satisfied this and the previous assumptions that I have stated. But we're very cautious not to attach any causality on the result. So these are the preliminary results that we have come up with. So the coefficient that I have highlighted there, we call that, then we can somehow call it then the gendered average treatment for the treated. So we were saying now, if a household has access to finance, so the inclusion there is the financial inclusion, which I said is 1 for a household that has access to finance, and 0 for a household that it doesn't have access to finance. Our dependent variable is our poverty index. So now a positive coefficient then now would mean that now if a household has access to finance and it is led by a male person, it emerges better post-COVID. So which means that now male-led families seem to be better than female-led families, which is a very interesting element. So to try and check now, just for robustness to check the consistency of our estimates, our model 1, then we don't include any control variables. And in model 2, we only include household level controls. Then in model 3, then we include state level controls. As you can see, there is a very minor change in the coefficient. So we can say on average, the coefficient is 0.5, which means that now it really doesn't change much. So that's why then we're saying now based on that, then we can infer some causality on this. But then what is actually interesting now is the coefficient of gender and inclusion. So where we're saying now, conditioned on the fact that now a household has access to finance, there is no significant difference between female-led and male-led households. So we find that interesting. But remember now this holds for this sample and based on these particular results. So the second set of results, then we look at the issue of financial resilience. So we also find similar results as well. But now what is very interesting now is the size of the coefficient now changes. It is higher than the previous. But also what we find very interesting is this second coefficient, the gender and the resilience, which is negative, meaning that now female-led households are better off than male-led households. So, or rather, the benefit is lower for male-led households than female-led households. So we find this to be a very interesting element, because it will suggest that now, although overall, households that have high level of resilience, if they are led by male, they emerge better. But however, if we factor in the issue of resilience, so it means that now maybe for female-led households, if we focus more on the issue of resilience, improving their resilience, it might actually help them to reduce that gender gap. In another analysis that we did, which we did not present here, we find that now consistently, when you look at the overall sample and the individual yearly samples, you find that now the average, whether for financial knowledge, the social capital, and the other elements is fairly the same, constant across both groups, but there is a variation in financial knowledge and behavior. So which would suggest that now, if maybe female-led households get more financial education or more financial literacy, then they might also be able to emerge better than male-led households, which might maybe even reduce the gap between female and male-led households. But as I said, for now, we can just make a casual inference. We need then to interrogate that further now to say, is this really the case? So we find that very interesting and also giving us something to think about as we go around the results. So which means that now as we go forward, then we need then to look at other issues now to say, is there any evidence, or what if we allow then the treatment effect to be heterogeneous across families? How does this change the element? And then also want to look at now to say, what is it that we can use then to drive the reduction of this gap between male and the female-led households? As you have said now, it appears financial resilience is more effective than financial inclusion. But at the same time also, financial resilience seems like it might actually help to reduce that gender gap. So I want them to then narrow it further now to say, what are the specific issues that maybe at policy level we need to focus on if we are to eliminate this gender gap? Of course, then would want them to come up with a decomposition where we're saying, can we interpret these results to be an indication of discrimination, or it is an indication of fundamental differences between men and women, or between female and the male-led households? So if it is an issue of discrimination, so find ways of addressing it. Or if it is based on fundamental differences or difference in the characteristics of the households, then you can also find ways now to say, how do we address this particular element? So our argument is we are trying to add a debate into the literature where most people in the past have been focusing only on financial inclusion, and other people now, they just look at now to say, does financial inclusion relate to financial resilience? So we think maybe by coming up with this, maybe we might trigger some policy initiatives on what is it that we need to do to reduce this gender gap and also to improve financial resilience amongst households. Thank you so much for your time and for listening to me. Thank you.